okay, and they're going to involve the public health team. Is there anything you wish to do to her? Like if she doesn't agree with you, she wishes to discharge herself. Yes, there's going to be a big um, conflict with her autonomy. Like she has the right to deny treatment. She has the right to decide whether she wishes to stay with the hospital or she wishes to go home. Okay, it's all right. But we have to have her here for the public interest because she doesn't have a fixed home. She's not going to her home. She's going to go to her workplace or go to any friend's home. Okay, and she might transmit the bug to others. So for that, there's one last resort we can do. We can detain her, and that's due to public interest. Yes, but before that, I will always involve my consultant. So if this patient doesn't want to stay in the hospital despite all the things you have said to convince her to stay here in the hospital, you will involve your consultant and ask her, request her. So would you have another chat with my consultant? Maybe you're in a better position to make you understand. Okay. So don't mention about detaining part to the patient. Okay. If patient is allowed to go home, would there be arrangement made for dots? Okay, that's an issue that you can talk in the future meetings. You will talk with the examiner. Now, if you have a scenario where you have a patient who has been non-compliant to the medication, then you need to raise the issue of dots in that scenario, or else not. So in this scenario, if she mentions to you, well, doctor, it's going to be too difficult for me. I have a very tight working schedule to take this medication daily, every day. It's going to be quite difficult for me. Then perhaps you could also mention, okay, I want to talk with my consultant because you have been mentioning the treatment offered in this scenario is not dots. Okay, they have mentioned here that your plan is to start her on isoniazid rifampicin for 6 months and two other medication for the first 2 months. So you have to, this is your task. So you have to sell it to the patient now. And if this patient comes to you after 1 month or 2 months and she's non-compliant to her medication, perhaps those kind of issue arises, then you can switch to the docs. Okay, so usually when they go home, they are monitored. There are people who monitor them time to time, like whether they are taking the medication. Okay, so if they find out that they are not regularly taking the medication, they're missing the doses because these are prescribed medication. She has to come to take her medication from the pharmacist. Okay, so if she misses to collect her medication, then that would show, you would know that she is not taking the medications regularly, all else would come for it. Okay, or we would know while we monitor her with those sputum tests that whether she has become non-infectious or not. If she isn't, then either she has a drug-resistant tuberculosis or she is non-compliant to a medication. So we'd know definitely that she's non-compliant. So in such circumstances, then we are going to go for the dots. Okay, unless otherwise we'll not mention dots in a scenario where you have been said to mention about the treatment plan. You have been already given a treatment plan, so don't bring anything from the outside. But with the examiner asks you this question. So if this patient visits you after 2 months and you find out that she's not compliant to the medication, she's struggling, then is there anything you can do for her? Yes, we can. Again, I will first educate her, counsel her, and we can offer her the observations. Okay, so it will give us, a bit of happiness inside that no, our patient is taking the medication good now, and that will ensure, okay, compliance as well. All right.
Excuse me, doctor.
Yes.
Doctor, what is this that you're mentioning? Dot? Dots? What is this? I don't know about this.
Directly observed therapy for tuberculosis. Like they take the tablets in front of you.
All right. What
So
is it
not
called?
every
Can you
day,
please
perhaps.
repeat it?
DOTS, the directly
All
observed
right.
treatment.
Directly
You
observed
search it in
treatment.
Google, you're going to find
Okay,
it.
got it.
Yes. Okay.
Doctor, if the scenario
Yes.
mentions that the patient has multi-drug resistant TB and admission is not written in the scenario, then is it safe to assume that we are going to admit him?
For a multi-drug resistant tuberculosis, yes, you need to keep him isolated for a while.
And that is also until the sputum is negative for 2 weeks.
That would depend. I really don't know about it. That particular for MDR TB, actually, they're isolated. They need to be isolated.
Okay.
And there the medications also are going to be much broader. Not only this medication, they will be on put on streptomycin and few other medication as well. It depends on the resistance. But in the exam, if you get a scenario, you get something like this. The simple tuberculosis, they might be active, but all you need to know is if it's mentioned that she has no fixed abode, then you are going to try to keep her in the hospital.
And
But
like
not
she mentioned that, will I get my drink in the hospital? Then what?
then you have to give practical solution. You have to first make her understand that we are going to give you some that drinking will be very bad for you now, because since you will be put on this medication, that's going to put a lot of toll on your liver. You can develop liver failure, you can develop this discoloration of your eyes. Okay, so this will damage your liver more.
But
Okay,
she's not going to become a teetotaler, right? So what should we say?
no, she's not a teetotaler. She is alcoholic. Okay, so those are teetotaler, we don't have any problem with that, but she is alcoholic, so it would be really difficult to withdraw alcohol because she's going to have withdrawal symptoms. So we need to say to her that we're going to give you some medication. Okay, so the bad you're having this bad feeling like the shakiness since you haven't been drinking for a while. Okay, and we can reduce these effects by giving you some medication. Okay, so you will try to negotiate as much as you can from your side, then involve the consultant. Okay, so someone who is on any hepatotoxic medication, we don't advise them to take alcohol. Best if they can avoid it overall.
Okay, because I said moderation. So that was wrong.
Moderation is also fine, because in UK, if you're taking them, like they don't like for absolute, reduction of alcohol, like they cannot stop it right away. But if you say moderation, that's also fine. Okay, but you have to tell her that it's better if she can stop for a while she's on this medication.
Okay.
Perhaps after 6 months she can again drink, okay, in moderate amount. But now it's going to, like any amount she takes is going to keep doing some damage to her liver. If you make her understand, then she will understand. If she doesn't want to, then it's fine, it's her right. But you have done your job, you have made her understood, you have told her the consequences. Now it's up to her whether she's going to comply or not. Okay, so anyhow, you did it well. I mean, overall. Yes,
One
doctor.
question. So is it okay to start antituberculous therapy right now, or we should wait for the alcohol withdrawal symptoms to settle down and start therapy later? What's the best way to deal it right now?
Okay, so at this moment you have to start the treatment, because the scenario tells you that you are planning to start the treatment on her now. Okay, so we cannot go outside the scenario. Now yes, did you get that, doctor? So don't show any judgment from the outside. Perhaps in your, like in your hospital setting or in your circumstances, you might manage the patient differently, but in the exam you are just, you have to do whatever they have told you to do. You are the candidate there. You cannot, you are just working for your consultant. So whatever is written there, you have to sell it to the patient. Okay, so you're the middleman. You don't have any right to decide what to do or what not to do. Whatever you have been asked to do, you have to do it. So if they have mentioned that you are to start the treatment, you mention it, but you also tell her that since you're having these symptoms, we'll address this. Okay, we might give you some medication to reduce these effects. You will feel yourself much better. Okay, but it's very important now that if you don't start you on treatment, this bug will do or keep on doing damage to your lungs, and you will develop permanent scarring. Okay, patients who have active tuberculosis, the lungs keep on getting damaged. Okay, so the earlier you treat, the better. Now, can I smoke in the hospital? You have to also advise on that smoking has various bad consequences over health, and mostly it affects the lungs. And since you have this lung condition, I advise you strongly to stop smoking. Okay, and in this case, you wouldn't suggest him to smoke in the hospital. Okay, of course, in certain
Doctor, what
cases,
about
in
contact?
certain palliative, pardon me,
This
Dr. Naseem.
contact tracing, we have to mention Yes, this contact tracing we have to mention it.
No, I mean, she did mention about the contact tracing. Okay, so that's with the examiner, because once you mention involve the infectious control team, that's their job. You are not going to trace who has been in contact with her.
Okay.
All you have to do, we have involved, when you mention it to her, she could also mention it to her that for your management, we have already formed a medical team. We have informed about this to the infectious control team of our hospital. Okay, we've already taken measures ourselves. Okay, like if you go to a patient with COVID, you're not going to go there without a mask, of course, right? Okay.
Yes.
Yes. So you have taken your protection. You have already informed the infections control team, and they will do their part, doing the contact tracing or finding out ways that who has been in contact with this particular person. Okay, and to monitor him as well, like whether he's going out, what he's doing. They're the one who are going to monitor. I'm just a doctor. Now, in palliative care scenarios, someone who is in the end of life, they can smoke. For them, like someone has a terminal cancer, if they wish to smoke, you don't ask them to stop smoking. They can smoke. Okay, but this patient, he is not a terminal patient. We'll advise him to stop smoking. We cannot ask him that, okay, we need to arrange there is the stairs are there, you can smoke there. We will not make such arrangement. Okay. All right. So that's not our part of the negotiation. Rather, for her own good, we have to advise her to stop smoking or cut it down. We can offer smoking cessation clinic as well. All right. So in the communication part, well, I think you did it well. The overall, you tried to highlight the side effects of the drug. You tried to check the understanding. So everything was right. Just you didn't touch the pills issue, the birth control pills and pregnancy. Okay. And some safety netting could have been added at the end, that if you ever notice that you have noticed any ileus discoloration of your eyes later when you are getting this treatment, okay, you have to come back to us, you have to inform us, and meanwhile we'll be also monitoring you. Our nurses in the community will be visiting you, okay, to make sure that you are getting this medication, you're taking them rightly, okay. And also offer, you could have offered some at the end, if you have time, some leaflets and brochures on tuberculosis. And also checking understanding at the end is also very important, because this is a discussion. You have described the disease, so you wish to know from her how far she has understood. So you check understanding. So may I ask you that how far you've understood from a conversation today? So checking understanding is also important in this scenario. So the number of scenarios we have done recently about describing a disease, it's very important to check the understanding at the end. Also, when you discuss any procedures, it's very important to check the understanding at the end. That's part of the task. That's on the examiner's paper. All right. Okay.
Sorry, may I ask a question?
Yes, doctor. Go ahead.
Regards to pregnancy, are these medications, anti-tuberculosis medication, has any side effect during the pregnancy? Because you're going to ask the patient about that. Is it important to know?
Yes, there might be some interaction with the pregnancy. Just it has to be planned, and it has to be dealt with the doctor.
Yeah, I know. But if she said I'm pregnant at the moment, then is it anything?
Yes, then you have to mention that. All right, since you're pregnant, I will address this. I will mention this to my, consultant. Okay, and we'll involve the woman doctor in your management. The doses might be changing. Okay.
Okay.
Because there are some medication you cannot use during the pregnancy. Okay.
Thank you.
And
Yes.
for birth control pills, we'll say that we'll talk to the woman doctor for alternative method of contraception.
Alternate methods like barrier methods. Just say some alternate method of contraception, because the birth control pills might fail.
And that is because of the rifampicin, right?
Yes.
Okay. Thank you, doctor.
All right. So that's the important thing here. Like few aspects, candidates commonly miss in the management. Okay. All right. Let's move on. Yes, doctor.
Tuberculosis therapy are safe in pregnancy, as far as I know. No need to change the dose. Maybe I'm wrong, but I have read it somewhere.
No, there are some medications like, I mean, not the regular one you're giving, like streptomycin, some other treatments, they needs to be like in this kind of scenarios. I know that practically, perhaps the medication we're giving, there might not be any side effects, or maybe it's safe, but still, if the pregnancy issue is raised, you have to involve the woman doctor. It's not important that whether you judge that whether this actually does any damage or not. It's important to involve the woman doctor then. Okay, and
Mm-hmm.
some
So
medication we use.
I was okay.
Yes,
I was talking about four
the
drugs:
four
isoniazid,
drugs.
rifampicin, ethambutol. Yeah, those are safe.
Yes, they might be safe, but still we need to adjust the dose. Okay, because we give the 4 FDCs, right? So I mean there might be some need of checking up the doses. Okay, so you involve the woman doctor. If you don't mention the woman doctor, they are going to cut you. Okay, we have another case. Let's go ahead. Now, this is open to all, anyone willing to take the case, or I will call someone's name. Anyone up to take a case with me now? All right, there was a doctor named, what's the name? Let's see. Dr. Zera, are you here? Dr. Zera, are you in this meeting?
Yes, I'm here.
Would you like to take a case?
Sorry, I'm working as well right now, so I'm just doing a to and fro thing.
Okay, all right. No worries then.
Yeah, I'm so sorry.
Okay. All right, if not, then let me pick. Dr. Aisha, do you wish to take a shot? I mean, giving preference to those who are candidates. Or anyone?
Which station? I'm sorry to ask, which station?
Station 4.
Okay, I will take it. If there's
All
no
right,
one.
so let's do it with Dr. Sharja, okay? Okay, so she has come forward. That's good. Can you see your case? You've got 4 minutes.
Yes, okay.
Yes, doctor. This is Mr. Macro here today.
Nice to meet
I'm
you.
65 years.
Okay, nice to meet you, Mr. Macron.
Same here, doctor.
Okay, we are here to discuss about the result of the imaging and SNP test of your lung, if that's okay with you.
Okay. Yes, doctor. I've been struggling with it. I'm very worried, like what's happening to me.
Okay. Do you want anyone else to be with us in the meeting?
No, doctor, it's fine. You can go ahead.
Okay. First, I want to know how much you have been told so far and how much you know about your current condition.
Well, doctor, I have been having this shortness of breath and I have coughed up blood several times and I was feeling so tired the last few months. And I went to my GP and he told me that this could be some infection and he offered some test. And then he did a scan of my chest and later they also advised me to go for some detailed scan and they took some SNP perhaps. And I'm waiting for the test results today.
Okay. So, Mr. Macron, what's your expectation from today's visit?
Well, I wish to know what kind of infection I've got because I've been really suffering and struggling. So, and whether you can cure me.
Okay. So, Mr. Macron, as you have said, because of the symptoms and the tiredness that you've got with the coughing of blood, we did some imaging, and at the end, we went through a SNP test of the covering of a layer of your lung. And the result has come back, which unfortunately are not as we expected.
Okay. So, isn't it an infection?
Mr. Macron, I'm sorry to say that unfortunately you have a condition called mesothelioma, which basically is a cancer of the covering layer of your lung. I'm sorry to say that.
I have a cancer? Are you sure?
I'm so sorry, Mr. Macron. Yes, the result has come back and we checked it, and unfortunately, that's the diagnosis that we have get from your SNP test.
Oh my God. What's going to happen to me then? Am I going to die, doctor?
Okay. Mr. Macron, I'm going to discuss about your diagnosis, but at this stage, do you need anything? Do you need a glass of water or something to calm down?
Thank you, doctor, but I'm very weak now.
Okay.
What's going to happen to me? Am I going to die?
Okay, no, don't worry, Mr. Macron. We are here to support you and we are here to help you. What has happened is that nobody can say what will happen in the future and and what's going to happen and what's the next stage. But we can say that unfortunately the disease is very severe and it's very extensive. So at the moment, we don't have any curable treatment for your condition, but we can support you. We're here to support you. We put you under follow-up, and we will stay with you throughout your illness and try to make you to feel as much comfortable as we can. Are you with me?
But doctor, I know I am with you, but I know that patients with cancer, they often have surgeries, they get chemos. So why you are not offering me those options?
Mr. Macron, cancer have different shapes, different types, and different stages. Unfortunately, in your case, it's very expensive, and unfortunately, there is no curative treatment. Any medication for the cancer, if given to you, would not treat your condition, even it would cause you more harm. That's why we're not going to try that. Instead, we're going to control any symptoms. We're going to give you any treatment which would control your symptoms. For example, if you have cough, if you have pain, or things like that, we can support you with it. Or if you think anything, we can give a help for you with it. But medications and surgery and chemotherapy in your case, unfortunately, are not helpful. Are you with me, Mr. Macron?
My God. So, yes, I'm with you.
Okay. So,
How could this happen to me? Is it because of smoking, doctor?
okay.
Why do people get this kind of cancer? I do smoke. Is it for the smoking?
Okay. So, smoking can be one of the reasons, but I'd like to ask some other questions from you, if that's all right. Okay.
Yes, okay.
Okay. May I ask you, what do you do for a living?
Yes, that's all right. Go ahead.
What do you do for a living, Mr. Macron?
Well, I'm retired now.
Okay.
Well, I'm retired now. I used to be a construction worker.
Okay. And for how long you have been working as a construction worker?
My entire life for more than 40 years now.
Okay. So there is a connection between your job. There's a possibility that your job can have an impact on your health, and that would cause the problem with your lung. That's why if you would like, we can refer you to a specialist doctor in industrial disease, and we can further investigate it. So if they prove that your disease is directly connected to your job, you can ask for compensation. That's why people with this condition, when their disease is related to their job, like yours, can do. Does it sound clear for you?
So I don't get it, doctor. How could this condition be related to the job? Like, many of my friends have been working, but they don't have this breathlessness. I mean, we work together.
Okay. Yes. So people have different, body has different response to different situations. But smoking, as you know, many people would smoke, some of them get cancer. Smoking has a bad effect on general health, but in some people it may lead to cancer. And in your case, I think that smoking has an additional effect as well. The same is with your job. Not everybody is getting the same disease with exposure to the same, for example, substance. Some patients, some people with contracted disease in exposure to some industrial material. It must be like this in your case. We can help you if we refer you to the doctor which is working in industrial disease. And if it was related in your case, which I think it is, you can ask for compensation. That would be a help for you and your family, I think.
All right. So, I mean, no one told me before that my job could have led to these lung cancers.
Okay.
And of course, I'm going to look for this compensation. So how can I get this, doctor?
Okay. So we refer you to occupational health department, and that would deal with this better. I can tell you, till now, I can tell you that there is a possibility, and we can refer you to proper sectors which can deal with such problem. Is that okay with you?
All right.
Okay. And you said you're smoking, and I think it's very good to stop smoking. It's very important to stop smoking because anyway, it's detrimental for your health, but it can help you. If you stop it, it can help you with your breathing, can make things a bit easier for you, and we can refer you to smoking cessation service as well.
Doctor, if I stop smoking now, will it cure my disease?
No, it won't cure your disease, but stop smoking anyway in any stage would be helpful, I think, even in your case. The symptoms may get a little better if you stop it, but it won't cure it, unfortunately, at this stage.
Okay.
Okay. Do you drink alcohol?
I do.
Okay. And are you drinking in a social limit?
I just drink around 10 minutes in a week.
Okay, that's good. And who do you live with?
My wife.
Okay. Do you need any support from our side? Do you need any support of dealing things at home, or any financial support that we can help you with? Refer you to a department which can help you with that. Is that all right?
Well, I would appreciate that. Basically, I'm depending on my pensions and I have to look after my wife. as well. I'm a bit worried now, like what's going to happen to her without me, and how did that I have a cancer. And she always asked me to stop smoking, but I never bothered. And now you tell me my job is responsible for this cancer.
Okay, Mr.
I don't know how things has gone to this stage.
Yes, I'm sorry for such a terrible news, but be sure that we are here to support you and we will do everything that we can for you and your family. Is that all right? Does it make sense?
Okay.
Okay. I just want to mention
Yes.
a few things. People in this stage of disease, in disease which are not curable, may make advanced wishes regarding their treatment that they would like to have in the future. So you can think about that, or you can assign somebody to make a decision on behalf of you if your condition is not good. So that would be helpful that we know what kind of treatment we'd like to have in the future or not.
All right.
Okay. So we're going to involve the social worker and occupational therapist and also specialist nurse. And if you have got any pain, we have a good team to control your pain as well.
We have 2 minutes left.
Okay.
Okay.
Do you have any special concerns or questions for me?
Doctor, just honestly tell me, like, how much time do I have in hand? And I wish to fly. I have a son who lives in Australia. I wish to pay him a visit. It's a graduation ceremony which I wish to attend. So can I do that?
Well, I appreciate your concern. Nobody cannot say what will happen in the future, and nobody cannot tell you that when it's going to be so bad for you. But if you don't mind, I'm going to go and have a chat with my consultant and have his opinion with regards to your condition to see if that would be all right for you to have such a long flight or not. Because of your symptoms, I'm not sure that I'm not sure to give you. I will ask him back to you.
Okay. With the covering of my lungs, and it's likely that my smoking could have caused it, and also my job. And I'm feeling now that working as a construction worker is a curse, and it can happen to anyone, but randomly it's me who has been affected. And I wish to visit my son and tell me that you're going to talk about this to your consultant.
Yes, I definitely will do it for you to see if it's going to be possible for you or not. Okay?
Okay. All right, your time's up.
Okay.
For 40 seconds to prepare your thoughts. All right, doctor. So, are you there? Hello.
Yes. Yes, I'm here.
Right. So, how did the conversation go with Mr. Macro today?
I tried my best to explain the condition for him, to tell him that His condition is unfortunately in a stage which is not curable, but we will be there to support him. And there were some supportive measures there that we can provide him with them. And I tried to
So
inform.
have you got a name for these supportive measures?
Yeah, I said that there's a occupational health department for compensation, and I said social worker, or if he needs any adjustment while I ask him with whom he is living. And also I offered him that there are multiple team for controlling the pain of the patient as well, such as I didn't mention the Macmillan nurse by name, but I would like to mention it as well.
Okay. And what was your task? Like, you are putting him under palliative care. Did you mention it to him? Did you mention it to him that you're going for the palliative care?
Yeah, I told him that unfortunately his condition is not treatable or curable, but I told him that the kind of treatment that we are providing him with the controlling of his pain and any symptoms that he may develop. I explained it in this way. So maybe I should have gone through that a bit more. I know he's not a candidate for any kind of treatment, so that would be just if he needs admission for example, fluid drip, or if he has got any infection superimposed, that kind of treatment. I wish to explain those things as well for him.
All right. So what do you think, is possibly related, like you said, that he's a construction worker, and at what kind of construction does he work? Do you think you could have asked that? And you mentioned like all construction workers get this, they have a chance of developing. Is it so, or you would be particularly worried about certain special compound?
Okay, I didn't specifically ask about asbestosis, I was not sure if he was even aware of the substance of asbestosis, but I thought that maybe just referring as a mesothelioma is usually a disease that is associated with contact with asbestosis. But I'm not in a position to make a decision that if his condition is that. So I think a pulmonologist who is aware of the industrial disease or a doctor who is aware of industrial disease would be more informative for him. I just mentioned that there is a possibility because mesothelioma is an industrial disease. So because my knowledge about that is not enough to make a suggestion, I just offered him that would be a good idea to refer him to that section so he can be evaluated further and get a definite diagnosis and for the cause of his condition.
So where exactly are you going to refer him to?
Occupational health department and a pulmonologist who is aware of industrial disease would be very helpful in that regard.
Okay, so like if he goes there, does he get the money right away, or there is any assessment process?
I'm not exactly aware for patients who are have a suspicious of having industrial disease. Coronation and the post-mortem is might be very helpful, especially the knowledge of a coronation and the input of a coronation would be very helpful. But I was not in a stage to talk about that. That's why I didn't go any deeper in that route.
All right. Okay, so if you had to go and do this scenario once more, what things you change and you do better?
Maybe I would explain more about the palliative care for him and about the support that are provided, about the Macmillan nurse, about the pain nurse, about the kind of treatment that would be available should his condition getting worse.
All right. So what are the ethical and legal issues you came across while doing this case?
Okay, so autonomy is very important, that the patient should have a knowledge about his condition and the medical treatment which could be available for him. Beneficence, non-malignant, and justice are the ethical issues.
Any legal issues?
I mentioned about last power of attorney and advance directive very briefly because this was the first time that we have a meeting with each other. So I just briefly mentioned about it. I mentioned about the compensation, which could be a legal issue in this scenario as well, and competence and being competent as a patient. Competency is also another legal issue.
All right. Thank you. Then move on to the next station.
Thank you.
All right. So Dr. Shaja, okay.
Yes.
Where are you from, Dr. Shaja?
I'm in UK at the moment, but I'm originally from Iran.
Iran. Okay. All right. Nice to know you. All right. So let's go back to this case. It's a very important case, actually. It is more common than the other one we have done today. Okay. So let's see. Okay. Now, you have got the structure, you know what to do, but I think you missed on, your task. Okay. So let's go into the scenario because, we don't have much time. Okay. So again, this is another scenario where you're discussing a disease with someone. Okay. You have to understand or imagine that perhaps the one sitting on the other side doesn't know anything about the mesothelioma. Okay. And there's some good things she has done, and there are ways she could further improve. Okay. So, of course, you have done something really well. Okay. That you mentioned is a lung cancer, and you would, uh, struggle with words, how to describe the mesothelioma, but you did it simply. But you could have done more. Okay, though you discussed the palliative care, but you didn't mention about the palliative care at all. You have to mention the term palliative care because it's mentioned here that you can decide to put him under palliative care, but you didn't mention the palliative care for once. Okay, so what you did, you just mentioned you're going to give him supportive care, but he has to know that it has got a name called palliative care, right? So you didn't mention it once, so he doesn't know at the end of till the end of your conversation that what form of care you were actually mentioning, that what kind of supportive care. So he has to know that you're putting him under palliative care. Okay. The other thing is the cancer is a bit late stage. Perhaps it has spread. Okay. I mean, it's a later stage. Okay. And that's why we are not going to go for the other sorts of treatment like chemo and any surgeries. Actually, mesothelioma is quite advanced once it's diagnosed. Okay. And it has a very poor prognosis. And anytime you get this mesothelioma, you have to raise the issue about asbestos. So from the outside, excuse my handwriting. Okay, so from the outside, okay, before you go inside, you have to raise these issues on your paper so that you know what to touch once you go inside. So the things we care about, we take a role, you're the doctor in the cancer ward, and this is a diagnosis of malignant mesothelioma, and you have your patient, this is the age, is an elderly. Okay, and questions commonly which will rise in this scenario that you can expect that how much time has he got. There'll be issues about flying, driving. Perhaps he's going to ask you. There'll be issues like how long does he have in hand, why you are not curing him, does it have a cure, and you have to explain the condition mesothelioma again. Okay, so you explain this condition mesothelioma, you have to explain it in words like she did, and then you have to also describe what test has been done and what you have found out. So you go inside here, don't say, I told you that we do not give any greetings while we break any bad news. Okay, so better not to mention or show these gestures that nice to meet you, good morning, good afternoon. Okay, she just said nice to meet you. Oh, well, that's fine. Okay, or good to meet you, but better, I wouldn't do it if I were you. Okay, so I would just avoid it. I would just say hello. That's a better way to start it, and I will already change my tone when I'm starting. Okay, so just say hello. I'm one of the doctor in the cancer ward today. I'm here to talk about your health condition. May I confirm your name and age, please? Are you Mr. Emmanuel Macro, 65 years old? Yes, I am. All right. How would you like me to address you today? You can call me Mr. Macro. Fine. Would you like someone else to present here? No, because you're giving me bad news. You can invite in someone, but make sure you don't ask to bring someone in whenever you are discussing confidential issues, okay, or anything confidential. So then go ahead, check his understanding. So may I know how much do you know what has been happening with you so far? I've been feeling so tired. I've been coughing out of blood, and I was really worried that some scans, special scans, followed by SNP. And I'm here for my test results. I'm very sorry. So remember that throughout your scenario, you have to show sympathy and empathy. Sympathy is your sorry, empathy is what you need to do for you. Your empathy is action, sympathy is your emotions. Okay. So I'm very sorry for what you have been through. And I have got the test results. Okay. Before I go ahead, may I ask you that is there anything running in your mind like what has been causing this? Now you directly asked me about the expectation, like what do you expect from a meeting today? Now, before you asked about the expectation, you could have asked, like, what does he think? What's happening to him? What's causing all this? So I did mention to you that I was thinking it could be some sort of infection. Okay, that's why I'm feeling sick, and I'm worried. Like I'm wondering and looking forward to whether you have any cure for me. Okay, I appreciate your thoughts. Okay, but I'm afraid that the test results are not as we hoped. So we give a warning shot whenever we break a bad news. This is the first warning shot. Okay, and then you give a silence, then break the bad news, then the golden silence comes in. So you tell him that we're sorry to tell you that we got the results of your scan. Okay, and the scan of your chest showed that you have developed this fluid collection around your lungs, and there were some suspicious growth which we took a snip from by a special scan called the CT scan. And I'm very sorry to tell you that it has confirmed that you have got a cancer called mesothelioma, or you've got a lung cancer called mesothelioma. Oh my God, have you got lung cancer? Now, many would struggle how to describe this mesothelioma. Okay, so it's a kind of lung cancer, but it's a type of cancer that involves the lining, the covering of, you know, uh, many, like it can be any covering in your body, any covering of the organ, but especially here, it's the covering of your lungs. Okay, it's a cancer of the covering of your lungs, and it's a type of lung cancer. Okay, or you can say more clearly that it's a type of cancer which involves the covering of your lungs. Okay, and I'm very sorry to give you this news. Give a break, let the info sink in, and see his reaction. Have you heard about this? No, I haven't heard about this. Is it curable, doctor? I have a cancer. Are you sure? We are very sure that you have this. We have double checked. And I'm again very sorry to give you this news. But you're not alone here. We are here to help you. So we are very sorry, sympathy. We are here to help you with our empathy. And how are we going to help him? We have to tell him then. Do you wish to know more about this condition? So you didn't offer this. You didn't describe the mesothelioma much. You directly went to the management plan. So you should offer that. Do you wish to know, or do you know about this mesothelioma already, or you should know something about this? Okay. So yes, tell me everything about mesothelioma. What is this? So this is a type of cancer which basically on the lining which covers your lungs. Okay. And in your stage, there are different stages, but I'm very sorry to tell you that you have reached in your case, it has reached the last stage. So this is a point that there is no cure for it now. Okay. And this is actually a very progressive kind of cancer, and patients who have this, they can develop this, shortness of breath, they can have this cough out blood, okay, they lose weight, they can have persistent cough, and they get very sick at times. Okay. And I'm very sorry to tell you that we don't have cure for this, but at this moment, at your stage, our medical team has come to a thought. Okay, so we have decided to put you on this special form of care. Doctor, you say it's a cancer, but I've heard people get this chemo, they get surgeries for their cancers. Why you're not offering them to me? I'm very sorry again. Okay, so the cancer you have now, it has reached a very later stage, and at this point, okay, the chemos and surgeries, okay, they wouldn't help. I'm very sorry to tell you this. And what we can do now is only to treat your symptoms, and that's where we are planning to put you in a special form of care called the palliative care. So that's when you mention about the palliative care, because it's your task. Now you did everything, you described the palliative care in your own words, but you didn't mention the term. Now, if you don't mention the term, you didn't know, and they're going to cut you. There will be a lack of communication there. Okay, so Dr. Shadi, you did well, but you didn't mention about the palliative care here. Okay, you should have mentioned it, and then you should have described it. That's a form of care where we don't plan to cure, or we don't look to look for a cure of your condition, but we give you some supportive management. We treat your symptoms. Okay, so you need to make sure that you remain as comfortable as possible, and our mainstay, we're going to look forward to reduce any kind of pain, and we're going to make your days comfortable, okay, as long as you live. All right. So this is a care. Not only we offer this to the patients, we also take care of the families as well. So this support will be also back at your home, and this involves a number of medical teams. So we're going to involve our specialist nurses. We call them the Macmillan nurses. Okay. Also, we're going to involve our community nurses at your service. Okay. So we're going to make sure and that you remain pain free, okay, though will not be able to cure your condition. Is there anything else you wish to know? Okay, so that's how you describe the palliative care. But doctor, I wish to know, like, why did I develop this? Now, eventually this question is going to arise. Now, you could have also, describe it in a way like when you're describing the mesothelioma, like when you describe this mesothelioma, you can also tell it that the cause behind this mesothelioma. So that you could have done earlier. Okay, so you could have said that when you describe the mesothelioma, this is a type of cancer which involves covering of the lungs. Okay, and many patients who are exposed to certain chemicals, asbestos, they're more prone to develop this. So may I ask you that what do you do, or what you have been doing all your life? Okay, so what kind of occupation you were involved in? But after I was a construction worker, where at the shipyards. So a construction worker can be at any place, can be in the brickyard, be doing anything. So this particular patient would be working in the shipyard. Okay, so you have to ask him that, may I know, have you came across any compound or anything, any substance called asbestos? Yes, I do know about this and I've come across it. Okay, so that's when comes a legal issue, that you have learned that the patient has been exposed to asbestos. Now it's a legal issue that you inform him that he is, or he can get some compensation for this. Okay, he's liable to enjoy the industrial injuries benefit or disablement. So then you need to inform him that the type of cancer you have developed, it's at times could be linked to this asbestos. Okay, and I will inform you that I will refer you to the occupational health services, like you mentioned. Okay, rather you can also mention that there is a group of team which are called the Industrial Injuries Disablement Benefit Office. Okay, you can refer him to that office, or if you don't know about this, you can also involve to the occupational health workers. Okay, because you are liable to, you might get some industrial benefit. Okay, because the disease you have, you will get a compensation. But for that, you need to fill out a form. Okay, that's the B100 PD form, or there's a form if you don't know the name, and you have to, you know, write in details what has happened to you. You have to inform them, and they're going to assess you. Okay, and after the assessment, if they find that yes, you likely have this condition due to this industrial, exposure, then you will get this compensation. So there are two things you need to remind him. First of all, that his occupation could have led to this. That's a possibility, but that requires assessment. There's a time period for assessment. And to go for this assessment, he has to fill in a form which he can download from the industrial, this injuries reserve benefit, uh, which he can get from this office, or there are some sites as well. Okay, it's called the Department of Work and Pensions website. Okay, or you have it in your rider. Okay, the Regional Industrial Injuries Disablement Benefit. Okay, so these are the bodies from where he can get this form. He has to fill it in as early as possible. Okay, because he doesn't have much days. Like if he delays, he might not be liable to get that benefit. Since it has been diagnosed now, he needs to fill that form quickly, urgently, and you know, give it to those industrial injuries disablement benefit office, and they're going to send people or doctors to assessing. And if they find out that yes, there's a likelihood that this condition he has developed from this exposure, then he would get this compensation. So all you need to do is give him an idea about that. He has to fill in a form. He would go through this assessment procedure. Then he'll be liable whether he's going to get this compensation or not after the assessment. Okay, so then don't make it look like yes, he has got this mesothelioma, he's definitely going to get the compensation. It doesn't work that way. So you will make a referral that we're going to refer you to this. If you don't know these names, then what she did was fine. The occupational health department, and they're going to teach you or tell you about the industrial benefits disease sites from where you will have to download a form and you have to fill in, and they're going to send doctors to assess you. And if they find that this asbestos has been responsible for this, then you will get compensation. And you have to do this quickly, okay? Because if there's any delay, okay, then they might not approve the form, okay? So you need to just inform him that there shouldn't be any delay since the diagnosis to filling the form, okay? You need to do it early. And beside this, I'm very sorry again for what you have developed, okay? And we are not leaving you alone. So may I ask you, go a bit about the social, okay? Like how you're living back at home, what's you have asked the occupation, ask about smoking and alcohol. You might ask you that, do you think this is related to smoking? Well, there's a possibility, okay? There are many things which can lead to the development of this. Like one of them, high likelihood is when someone gets exposed to this asbestos, smoking has also been linked to this, okay? Doctor, can I smoke now? Okay, now in this scenario, this is a terminal patient, okay? So if he wishes to smoke, actually there is no point in objecting. So you shouldn't from your side say quit smoking here, okay? Because it doesn't have any more benefit. He is at the end of life. I mean, he doesn't have much days perhaps, okay? He has a end stage cancer. So if you even ask him to stop smoking, there isn't much good, okay? So the way she phrased it, in general, smoking, it's quite bad for health, or it doesn't bring anything good, okay? So you can cut it down, and at this moment, stopping smoking will not bring any change in the course of your disease, okay? Dependent on him